Welcome to Focus on Health, a series of educational programs highlighting current health issues sponsored by the Department of Nursing at Salisbury University. I'm Dr. Mary DiBartolo, Professor of Nursing at Salisbury University and host of the program. For this installment, I welcome Nancy Weller.
Hello.
Thanks for coming on the program. You are a pharmacist and assistant professor at University of Maryland Eastern Shore School of Pharmacy. Thank you so much for coming on the program to talk about this very important topic of medications and the older adult.
Thank you for having me.
Thank you so much for coming on the program. We hooked up a few weeks ago at a seminar together and decided that this would be a nice topic to address. We haven't done it in several years, but I think it bears repeating, and that's the use of medications in older adults. So why is that an important topic? I think we'll start with the fact that as older people age, things just don't work as well at clearing out medications and things, the kidneys and liver and so on. So older adults are more prone to side effects and toxic effects.
That's correct.
But I know there's many other issues that you'd like to address as to why we need to keep safety in the forefront as far as medication use.
Yes. So as we age, in fact, our actual population right now, by the year 2050, there's going to be 83.7 million older people. And so we're getting to live longer lives for a lot of reasons. We're getting healthier. We're becoming more focused on behavior modification in terms of lifestyle. There are also more public ads and advertising towards living a better lifestyle. And so I think the concern right now is that we need to focus on the elderly and how they use a medication. Older adults need help in terms of how to use their medication and what they're being used for and what the adverse effects are.
Well, especially because they're on so many, it seems, an average of what,
Yes.
14 prescription drugs a year, and the longer you live, that number tends to go up.
Right. That number, in actuality, over the age of 65, will be average about 14 prescriptions a year. And as we get older, the amount of prescriptions increases as well. So statistics show that at over 75 years old, the average use is about 18 prescriptions a year, which is an incredible amount of medications to be taking.
And when you say prescriptions, that means that you get from the physician or healthcare provider.
Yes.
That doesn't even include what we call over-the-counter drugs that many older adults may take for aches and pains or constipation or sleep and so on.
Right.
And any herbals or supplements they might be taking.
That's correct.
So what are some of the safety issues that would concern you? Because we know older adults do take a lot of different medicines for various chronic illnesses.
Well, we are concerned about the fact that older persons will go to different prescribers for different chronic illnesses. And so patients may come back with prescriptions that may not be appropriate. It may be duplicated, or they may have adverse effects between one medication and another. Those are just some of the few consequences that can occur.
And of course, you mentioned drug-drug interactions,
Yes.
and if they're on several different drugs, and drug-food interactions. Some drugs you have to modify your diet or take with food or on an empty stomach and so on.
Right.
So we'll get to all that in a little bit, the
Okay.
specifics. But let's talk about some of the key points you'd like to make about when a physician prescribes you a medication. What are some of the questions you should ask the doctor?
So it's very important to ask the physician what the medication is being used for. Make sure you understand how the medication may work. A physician may not go into the very detailed specifics, but you want to know how it's going to work for you. In addition, asking questions like, what am I to expect from taking this medication, and how long should I take the medication? Those are very important questions to ask. Sometimes some of the adverse effects that you may experience from a medication may go away after a period of time, but it becomes very problematic when the adverse effect worsens or does not go away. And so some of the questions that may be added to that conversation is, if I am going to have an adverse effect, how long am I going to expect, and will it go away? Because if it doesn't, then there are other alternative medications that can be used instead.
Right, I know sometimes the side effects can be more concerning than the problem
Yes.
that it's treating. And I know one of the problems we see happen is people may stop taking their medication
Yes.
because they feel like the side effects, are too much or too much of a burden. Or we also know in some cases for financial reasons, people may stop taking their medication or cut their pill in half or change their dosing to every other day. So we need to do a lot of education on that as well.
Yes, yes, that's true. If a patient does not feel comfortable with the medication that they're taking, whether it be because of side effects or because even of the cost of the medication, it needs to be discussed. That's part of the conversation that that patient should have with the physician, and even if not with the physician, with the pharmacist as well, because they can also provide alternatives and call the physician. So
See about getting
communication,
something.
yes, communication is so important between, all the clinicians involved.
And I guess that's why it's a good idea to get all your prescriptions filled in one place. And then
Exactly.
that pharmacy will have all your records and see
Yes.
everything that you're on. And sometimes that's what pharmacists do, don't they? They look at a
Yes.
list of meds and see if there's a problem with two medicines interacting or canceling each other out and so
Right.
on. Because sometimes it can be a matter of one medicine will prevent the other one from working, or it leads to greater toxicity, which can be a
Exactly.
problem as well. So they can suggest alternatives. And getting to that, maybe you can explain a little bit about the brand versus generic issue.
Okay, so brand names are typically more costly. In some cases, generics may not be available, but across the board, generics are just as good as the brand name product. There is nothing wrong with taking a generic medication. You will expect the same result from it. On the other hand, there are certain patients that may be sensitive and may just require a brand name. But in the therapeutic sense, there is actually no difference per se between the two. Insurance companies will typically pay for the generic across the board. There are insurance companies that will not pay for brand names. So cost effectiveness for that particular patient, that's a concern, of course.
Well, I guess if it's not available. And the newer drugs, you won't have a generic available for quite some time.
Right.
And I know many physicians will say that you shouldn't fluctuate between the two. If they prescribe you a drug and you're going to use the generic type, then just stick with that form.
Exactly, for therapeutic reasons, and also for if a patient has to be monitored, it's best to stay with one type, whether it be if just the brand name, stay with just the brand name. If they're going to have a blood level done, then they should also stay with the generic if that's the medication that they're using as well.
I know one other thing I always chuckle about: when you get a prescription filled, you get a lot of paperwork with it.
Oh my, yes.
Is it important to keep that paperwork?
Well, it's very important to read what you're being given. There are a lot of items in that communication piece that is very important to the patient. Adverse effects, in some cases it will tell you how to store it, what time of the day is best to take the medication, and when to take it in respect to meals or before bedtime. So it gives you very detailed information. I think it's best to save your information. Some patients may not want to keep them, but you can always refer back to that information for further.
Right, and keep it all in one place in case you need to go back. Now we know some drugs people are going to take every day, and then others you just take for a period of time. For instance, your antibiotics. So let's do our little spiel on how important it is to take the entire prescription of the antibiotics.
Yes. Yes, and so if a patient is prescribed a certain medication that is intended to be for a certain period of time, it's so important, especially in antibiotic use, that you follow the instructions to a T and complete the therapy. Patients may feel that, oh, well, I feel better. I may not need another 3 days worth of medication to take, but it is very crucial, very important to take the whole course of therapy for a proper treatment.
I know some people feel inclined to keep a little bit for the next
Yeah, I
time, but not
know.
smart. We know we have a problem with antibiotic resistance, partly due
Exactly.
to overprescription and not finishing prescriptions and so on.
Mm-hmm.
And let's talk about the medicine cabinet for a minute,
Oh.
where some of these things end up. You mentioned storage. I mean, where is the best place to store medicines? Probably not in the bathroom, where it tends to be
No.
very humid.
No, and I'm glad you brought that up because yes, most of us will keep it in a bathroom storage. It's best to keep it in a cool, dark place. It's very important that you routinely check through your medication cabinet, check for expiration dates, make sure that the medication that your doctor may have prescribed for maybe an indefinite period of time is still an active and good prescription, that it's not outdated. Some medications will chemically change, and so the medication will no longer be effective. So the expiration date is very, very important. The other thing I want to point out was that in storing medications, some medications have to be stored in some cases in the refrigerator, and that's as important as well. So it's very crucial that you follow the instructions in that communication piece that was given by the pharmacy where to store, whether it be in the medication cabinet, in the refrigerator, in a dark place. Some medications are photosensitive, and so all those little bits of information are very crucial.
And that applies to pills and creams and
Yes.
liquids and reading those materials that come with it. And of course, I know a lot of these instructions are on the labels of the bottle
Yes.
if it's very important. And of course, one of the things with seniors is vision issues.
Yes.
We're both sitting here with reading
I
glasses on.
know.
So the pharmacy can print up larger print labels.
For patients that are visually impaired, they can ask for the pharmacist to print out larger labels. In fact, in some cases, they may even use different color ink in some cases for patients that cannot read certain colors. If a patient, and we can talk about other problems that may come up, patients who have memory impairment can use pill boxes to store their medication and keep everything organized.
They have pretty sophisticated ones now,
Oh,
don't
yes,
they? Some of them would have timers in them, and you can lay them out for the week.
You can lay them out for the week. Some of them are laid out in terms of times of the day as well. So you can have a section for morning and another one for afternoon, another one at night. The other thing that's available is for people who have difficulty hearing. We encourage using pieces of information in place of communicating. We're very concerned about having pharmacists learn how to talk to people who are hearing impaired. And in addition, then they also hand out written information for that patient as well to supplement what they've told their patient.
And what about if someone's having trouble swallowing pills? There's other forms they can inquire about,
There
correct?
are many different forms of prescription items. They come in, multivitamins are now available in gummy, chewy substances, so they don't have to take that really big tablet, which is very common in older adults, difficulty swallowing. So therefore, liquids are also available, suspensions.
I know they even have oral disintegrating tablets for certain
Yes.
medications. It used to be
Yes.
just nitroglycerin, under the tongue dissolves, but now
That's
I know
right.
there's medicines for Parkinson's that come
Come in
with
dissolvable form.
dissolvable form.
Patches are also available for some patients who have difficulty even taking medications, who refuse to take their medications, and so you can use patches put for a mentally impaired patient. You can put the patch on the back so they won't pull it off. For family members who are concerned about
Sure.
those kinds of issues.
So these are things you can discuss with your physician. Different
Yes.
forms of administration, different medications if the side effects are too concerning. And then you can also talk to the pharmacist and they can call the
Yes.
physician for you if in between your visits you're having issues of some kind.
Yes, the pharmacist is always a good source of information. We know that it's very hard for older patients to physically go to the pharmacy or go, and so they can just pick up the phone and call. They don't have to go directly to the physician. Pharmacist is there to supply information and assist the patient in other alternative types of issues that they can discuss with the patient.
And I know the one thing I think about is I assume as you get older, don't get any more of those childproof caps.
they're
I can barely get those
terrible.
open,
They're
and that could be
terrible.
an obstacle for an older adult. Make sure you get the right kind of cap on it that
That's
you can
right.
easily
Yep.
open and
And
get
asking asking a pharmacist is very important. We have this easy screw top on those containers, and as long as you communicate that to the pharmacist, he'll be able to do that for you.
Let's get to another important topic, and that is people may have a couple different physicians or healthcare providers they're seeing. It's very important to keep a list of all the different
Yes.
prescription medications you take, along with over-the-counters and or any herbals, and have that list, available or carry it on you. And I think you mentioned that the MAC Incorporated and other organizations, I'm sure you can find these online, have specialized forms to help older adults keep their medication straight. So if they're going to this doctor or that doctor, or if they have to go to the hospital, that's a very important piece of their care, is to know all the different medications that they're taking.
Yes, that is such an important piece of information, because it is not unusual for an older patient to go see the primary physician or an ophthalmologist or a cardiologist, and they're not communicating with each other. Having that crucial piece of information where you have all your medication in one location is something that you can use as a tool to show your physicians when you go into a visit, or as you pointed out, to the emergency room, or even to the pharmacy. One thing you suggested that is very important: using one pharmacy is also another way that we can kind of monitor what's being taken and what can or cannot be given with each other.
I know we always tell people sometimes to use the brown bag method, which means if you're going to the hospital, put all the pill
bring all-
bottles in. I know that can be cumbersome for some people. So if you have the list, I think that's a fairly good replacement.
Well, another good thing about that list is it also gives other information, like, for example, if patient has chronic illnesses, and maybe something may not be treated, as for example, hypothyroidism. I've seen patients that may no longer be taking a medication for that condition, but if the physician becomes aware that that patient may have had that in the past, he can keep in mind that maybe he does need to monitor the thyroid level every so many months.
And that's one of those medications that you shouldn't switch around, branded generic
Exactly.
Synthroid or, yeah. What are some other important concerns? I mean, maybe let's touch on some of the dietary issues that can come up with certain medications, and say the green leafy vegetables with your
With the
Coumadin.
Coumadin, or for example, grapefruit juice with some of the medications that will cause drug-drug interactions, and the same thing applies to herbal products. It's so important to make sure that you also communicate what things you are, or if the physician doesn't ask, can you as a patient can say, I'm really enjoying eating this particular meal day after day. Is this okay? And sometimes the pharmacy will have auxiliary labels that we need to pay attention to, that will say do not eat certain dairy products, cheeses with this particular type of medications, and so on. So diet, yes, is very important, making sure that there are no drug interactions between a dairy product or a food product and the medication that they're taking.
And then the big one are like some of those herbals like ginkgo
Yes.
and ginseng. They can interfere with clotting times and so on. So if
That's
you're on
right.
an anticoagulant, Coumadin or whatever, it can be a real issue. Even aspirin. I think people think over the counters, are innocuous, and they're not.
No.
They can have some serious side effects. I mean, when you think of aspirin, you think of stomach bleeding.
Yes.
And in an older adult, that can be dangerous.
And on that same line, Dr. DiBartolo, patients may be taking, for example, an aspirin and maybe taking Advil at the same time, and the two together will, of course,
Compound,
complicate the situation. So that's knowing what you're taking and communicating that to a pharmacist or physician, again, is very important, because it can lead to other problems.
And I know we wanted to talk about an example of, say, a drug like Benadryl, who most people don't think much of. They think, well, it's just an antihistamine, or they put it in Tylenol PM to help with sleep because it has sedative properties, and that can be dangerous for an older adult.
It can. In older adults have a different pharmacokinetic within themselves. As we age, we have less protein, we have less body fat, less water, and our kidneys may not be functioning as well, or our liver may not be functioning as well. So sometimes when medications are taken, it affects that older patient, may be more sensitive than what they used to be when they were younger. And medication as simple as Benadryl or diphenhydramine may cause confusion and irritability in some patients. And so that particular medication is on the Beers list, which is a list of medications that's considered inappropriate in older people. Doesn't mean that they can't absolutely not take it. What it does say is that we need to be very cautious and look at whether or not that medication is truly beneficial versus not.
Well, there are certain drugs that will make a person, and it's particularly problematic for older adults, prone to falls,
Yes.
Affecting, bladder function, cause glaucoma and things like that.
Right.
So that's the other, many other reasons to keep your physician abreast of what you're taking and
Right.
keep a list and just stay on top of it.
Yes, and out of all the adverse effects, the falls are the most serious. Once a patient falls, it can lead to fatal or non-fatal situations for an older person.
Right.
So that is a very, very big concern with our older population.
So let's wrap up and just emphasize a few key points. I could think one thing we haven't mentioned, or maybe you did, I can't remember, is about if someone's on all these different medications, keeping the list, keeping it handy, keeping it on your person, in case you need to go to the hospital or when you're at the doctor's.
Right.
And having good dialogue with both your provider and the pharmacist about side effects, alternatives,
Yes.
Things like that. And calling the doctor if you're
Yes.
having a certain side effect that's distressing or it's ongoing and of concern.
Yes.
Because there's always alternatives.
Asking questions is very important. Also communicating with the physician what your effects from taking the medication. Sometimes it's not communicated to the physician because maybe they think it may go away, but every little bit of information any sign of something that doesn't make you feel comfortable while you're taking your medication should be communicated to the physician.
And if there's financial issues with medications,
Oh, yes,
there's assistance
definitely.
available, isn't there?
Yes, yes. There's financial assistance. There are prescription programs that are available, and communicating that with the physician. Pharmacists may have some of that information as well, with specific prescription programs that will help pay for some very, very costly medications.
Right, because they should take their medicines as
Oh,
prescribed.
definitely.
Yeah, especially blood pressure medicines are very common for this to occur,
Right.
because people start feeling, they feel fine, and they don't think they need to take their blood pressure medicine, but they do, because it's working to keep their blood pressure under control.
Another thing that we might have left out, social isolation in a patient may lead them not to get their prescription filled. So it's very important that we pay attention to our neighbors, make sure that if that person looks like they are not communicating with the outside world, that some sort of assistance be provided. These patients are almost forgotten, and so they don't go out to fill the prescriptions because they just feel isolated, or maybe they're not physically capable of going to have the prescriptions filled. So that's a big issue in the compliance area as well.
Then some pharmacies have delivery services.
Yes, there are
so-
there are quite a few, especially some of the mom and pop places in town will provide free delivery services to people that are unable to, have transportation to get there.
Well, Nancy, thank you so much for being on the program.
Oh, you're welcome.
So many helpful bits of information and important tips about medications that so many people take, needing to know how to manage these better and having good communications with their physician and your local pharmacist.
Yes, thank you for having me, Mary.
And thank you for joining us for this edition of Focus on Health here on PAC 14.